So you can get lasers if that's what you're targeting. Skincare is very important. Again, you're talking about maybe a millimeter worth of, whatever results you're going to get. Also radio frequency. So this is a different type of heating called bulk heating. That technology is really great, but what happens is with bulk heating, you're not able to actually see where you're treating. A, and B, you're not sure where it's going because it's bulk heating. The difference between radio frequency and Althera is that we're micro-focused and we're looking at what we're treating, which I'm going to show you in a second. So this is awesome because we know that we have to get in between this level of heat, your 60 and 70 degrees Celsius, in order to denaturize the protein. So in order to actually break it down so that the result is your body naturally rebuilding, this is the temperature we need to get to. What's incredible is that we can do that non-invasively, right? We can get to this heat without hurting you or it being unsafe, and that's the reason for that is because we use the sound waves. So what happens is when the energy is delivered through that transducer, it goes to whichever depth that we are actually telling it to, and it crosses once it gets to that depth, and we call that a thermocoagulation point. At that moment is when it's delivered, the energy is delivered at this depth, this temperature, and that's how we do that non-invasively, right? So we go through the different tissue layers until it gets to the point that we're specifying, and then it crosses for that TCP. So what you're seeing on the screen here is what doctor is looking at when he's looking at the screen. This to you is probably confusing, but what we're looking at is what we're trained to do is find your collagen in the screen and target exactly where we need to be. In this particular picture, this is 4.5 millimeters, which is the transducer that we're using. And the reason for that, this is the treatment line, the screen line, is because this little railroad track here is this patient's collagen. So, for example, just like Dr. Deffenbaugh said, if he's visualizing and he's here in this region and we're not seeing it here, but we're seeing it here, we're going to target 3.0 millimeters. So he's going to customize it according to what the needs are for your skin. Lower face, which you can see starts just right about underneath that under eye area, which we call lower face is here, and that includes the submental area. We also do the lower neck. Thank you so much. So this is what the machine looks like.